the time of workshop is a time that is very, very important. Open yourselves to bring out what you would want to ask. All these are sisters that we have today. They are sisters who go into their jobs and somebody come in and pay them. Don't they? Yes. And when we come here, they give to us freely. Let's use it.
My full name is Florence Juma. I love the Lord. I've loved the Lord. I was brought up by my father who raised us in the ways of the Lord, in the church. But at the age of 11, that's when I committed my life to Christ. I've walked with him and served him ever since. The Lord has been good. He has seen us through challenges, through life transitions. My service began as a pastor at the age of 18. I had a huge interest in teaching. I just saw myself going into the teaching profession. So I just felt that's where I sensed my passion. But after high school, while I was contemplating going to teacher's college, the Lord spoke to me and he called me to the ministry. So instead I went to theological college, and that's how my ministry began. But eventually the Lord, there is a scripture that my dad taught us, and we have to say it every night before we go to bed. The fear of the Lord is the beginning of all knowledge. I didn't even know it was from Proverbs. I thought that was just a saying that you say after you say your prayers, then you say that. And in the morning when you wake up, you have to say, so let your light shine before men that they may see your good works and glorify your Father in heaven. I had no idea it was from the Bible. Before you learned how to write your name or even how to read the alphabet, you had to learn those two scriptures. You say them in the morning to go out, remind yourself that you are a light in the world, and you say them at night. Say, for all the things you have learned, they are nothing if you don't fear God. And the Lord called me to the ministry and almost made that scripture a dual. My life, I wanted to be a teacher, but the Lord said, this is where I'm calling you, and eventually put me back in the classroom. So I teach part-time in a seminary for people training to become pastors. The aspect that I teach is spiritual health psychotherapy, integrating faith, scriptures, spirituality in psychotherapy. Without spirituality, without faith, without biblical principles, therapy is dry and doesn't touch us deep enough.
And we have other professionals. Open yourselves to bring out what you would want to ask. All these are sisters that we have today. They are sisters who go into their jobs and somebody come in and pay them. Don't they? Yes. And when we come here, they give to us freely. Let's use it.
Okay, we'll give a minute for a break. But my name is Dr. Mercy, as introduced. My background is in health, so I'm a health consultant. Also in education, because I teach. I have dealt with the issue of mental health for quite a bit now, and I'm happy to share the experiences that I have. I am married with 2 kids. I have my daughter here who is 6, and my son who is back at home with my husband. My son is 3, and I'm born again.
Amen.
Amen.
Hi everybody, I'm Lillian Udera from Maryland. I love the Lord. I'm a clinical psychologist. I practice in Maryland. I'm a professor. I teach at Towson University, and I teach at Purdue University as well. That's it.
Hello everybody. My name is Dr. Sarah Gatumu. I am a triple-boarded physician currently working in Pennsylvania. I am board certified in child adolescent psychiatry, adult psychiatry, and addiction medicine. I also offer nutrient-based approaches for patients challenged with autism spectrum disorders, behavioral disorders, ADHD, ADD, anxiety, clinical depression, bipolar disorder, schizophrenia, and neurodegenerative disorders. I am so happy to be presenting the current workshop with my co-presenters.
I have a question. My question is, recent past we have seen the rate at which our young children now, maybe between 15 and 20, we have seen an increase in suicidal cases. And we have a recent case that I think Jerry Jagger would attest to it in Texas, where a 15-year-old committed suicide because her boyfriend left her at 15 years. Now, the speculation by those who have no experience tells us that the mothers or the parents in America do not know how to connect with the youth so that we are able to avoid such happenings among our youth. And it's like, when it's an outcry, it is everybody's problem. But when it is a real deal, it is each parent's problem. What can you help us as parents to know how to connect with our youth so that we know either the language to use to talk to them, or to know what steps we can do as parents so that we can be able to reach our children and effectively train, so that we don't get, because it's been an outcry, especially among the migrant families.
All right, my name is Mr. I'm used to teaching, so I usually do this standing. But as I said, I'm Dr. Marcy. That's a very excellent question, because that specific question that you explained so well is happening all across the state. I am from Boston. It has happened in Boston as well, as recent as a few weeks ago, actually, right, for young people. And it's usually actually happening from teenagers, as you say, all up to the age of maybe like around 26. So it's the teenagers and people past college, kids who graduated college and then maybe are out on their own or something like that. And in Boston, and I have a few of my colleagues here, we actually ask the same question, what's going on and what can we do? So we actually organized meetings across Boston to meet with kids, with teenagers and parents, but we separated teenagers and parents. We were actually supposed to have a meeting today that was cancelled, and that's why I'm here today. But the idea was the same thing that you're sharing, to try and understand what is going on. Now we have had several meetings since we started saying, of course now we have too many suicides here. And let me tell you, one suicide is one suicide too many. So when you're having, like in our community in Boston, and you're counting, okay, January, alafu March, alafu, when you have like now you're counting up to like about 8. Some of them happen and we don't really say it's suicide, but people say, it's suicide. But when you have more than one in your community, if you have them more than one, it's a crisis. One is too many, more than one is a crisis, and that's what has happened. Among the things we have found, and I can't quite say that we have the answer. Hopefully, I'll give it to my colleagues and maybe they'll give us a little bit more answer. But among what we have found talking to teenagers, which is primarily what I've been doing now the last few months actually, since December, when we say, okay, no more suicide, is that we are having an issue with the communicating with our teenagers, as you say. And this is actually what the teenagers themselves are saying. What is going on here, right? And usually one of the questions that I ask them is, what would you like me to communicate to your parents about what's going on? Among the things that they say is that we do not understand each other. We don't understand them, they do not understand us. And among the things that they accuse us of doing, and I'm now giving you the parents, and so that we can at least do something about that, is we do not give them enough quality time. And let me tell you something, that is very true. This society, this community is very different than what we grew up in. And let me give you a picture. When you grew up in our village, like if I think about when I grew up, my life was formed about me living with my mom and my parents and my community. It was like I was a part of a community that correctly brought me up. And that's why in Africa we have a saying, right? The child is brought up by who? By the village, right? So when I woke up, think about how much I interacted with my parents and with the community around me. I would wake up, we'll milk the cows, I would take the milk to the shop. As I'm taking the milk to the shop, I'm meeting with women, the women who are like my mothers on the road, we are chatting with them and all that. I will come back, we will go to pick coffee. I'm from Kiambu, so we pick coffee. We are picking coffee and all that. There was a lot of interaction between me and my family and my parents and the community at large, and a lot of places where we converse. Now, if you think about this community here, Well, me, I was going to the farm with my parents, and I'm assuming some of you, and we conversed a lot around dinner table. Because again, think about dinner. When you were eating, meals were eaten together. Breakfast, although it was just tea without bread, you did that together, right? Lunch, when you were home, when you're not in school, maybe when you closed or whatever, you were doing it together as a family. How about dinner time? It was together as a family. Although we did not appreciate it and we did not even realize, there's a lot of quality time, a lot of information that was communicated between you and the parents. Okay, now here with the girl that you are seeing here, Shiko, how much time? She's only 6. How much time do you think I've spent with her for those 6 years? As compared to the time my mom spent with me since I was 6, even if we were to get around the same age. Because now here, I wake up, I put her in the bus, I go to work. I come back in the evening when she's almost going to bed, we do homework, and then I put her to bed. So really, we are spending a little bit of time with our kids. And what the kids told us in Boston, as my colleagues from Boston can attest, we are not spending quality time together. And they say they feel like they have no one to talk to. That was one. The other thing that they said, and I hope we can take this to heart, that even the few times we talk to them, we do not listen to them. We are basically giving them lectures. Oh, and I will tell you what kind of lectures they say that they give us. They say that when they come and try and tell us what's going on, immediately we don't even let them finish the sentence or whatever it is that they're telling us. We start telling them, quit complaining. Do you know what we went through back in Kenya when we grew up? Then from there, we start giving them the lecture. So for those who are suffering, like your question, either they are being bullied in school, and trust me, our kids are being bullied, whether they are being discriminated, whether they are facing racism, whether they are being made fun of because of their hair, the accent, the funny accent of their parents. When they have, I say they have attempted to come and tell us stuff, we rebuke, we basically tell them we are complaining and we start telling them about the farm. The most profound statement I've had from a child, and hopefully maybe this can help us going forward, is a child who told me in one of those meetings that they wanted me to communicate to any parent I can get, so I have you guys, that although we think we grew up in a very hard place and we grew up with a lot of hardships in Kenya, that we please need to understand that our kids here, this is what a young girl was saying that our kids here they say, we usually tell them about the farms. I'm going to actually quote her. They said, we usually tell them about the farms that we grew up, that we were digging and all that. That's basically what we tell them. And she told me to tell you guys that even them here, they have their own farms. We tell them about that. They say they have their own they have their own farms. They have their own challenges that we even probably have not attempted to understand. And that's why when they feel like they come to tell us something, we are not listening, we are telling them about their Megoda. At some point, they quit telling us. So you realize by the time they get to teenagehood, we don't have that communication. And so to them, they are resorting into things like suicide and stuff like that. So my plea to you is, I think we need to listen, spend more quality time with our kids, try to figure out how you're going to incorporate that. Because of course, it's a very busy country, we're working doubles and all that. Quality time, who has time for quality time? You know, like, that's kind of what they think we communicate by not spending time. Try to find out how you can incorporate quality time with your kids, right? All of us. Whether it's taking them to dance, you don't take them out for dinner, take them out shopping, but we need that time. So that they can, when they are now suffering with the issues they're suffering with, clearly they're suffering. For you to get to a point where you're committing suicide, you don't just wake up and commit suicide the following morning. That takes a whole lot of process, as my colleagues here will tell you. And for a child 15, 13, 20, 18, as we're seeing them attempting them, and it's happening all across the state, not just Boston and Texas, we need to try and hear them out. Please let them finish the sentence so that we can figure this out together. Please, quality time with your kids, let them finish the sentence. Don't give them lectures about how we grew up in Kenya and they quit complaining. Hear them out so that we can understand what we're going through. Thank you.
Thank you. I just wanted to add about resilience. And resiliency training for a child begins as soon as they can start, as soon as they're born. Spending time with that child, bonding with that child, telling that child who they are to you. Even those few minutes that you have them in the morning before they go to school or wherever, having a good church home where the pastor and the other people in the community, in the church, are helping them, a place where the child will be able to stand and know that whatever they have to say can be heard, not just with the parents, but also with other people in the community, so that they can get that value of themselves
so that if they're being bullied, which they probably are, they will still have something to fall back on. So one of the questions I have here is, can someone with bipolar diagnosis and medication get pregnant? And if they can, what medication is safe for pregnancy? Can such a person on such medication do fasting? And I can start with the first question, the part of pregnancy and medication. Of course, there is all these warnings about what not to do, that there are chances of fetal abnormalities. But if somebody is pregnant, and they have a diagnosis, whether it's depression, bipolar, anxiety, or whatever, and the symptoms are interfering with their day-to-day life, they will need to be treated. The safety of the mother comes before the safety of the child. And there are some safe medications. The one that does not have a black box warning as far as pregnancy is concerned is called Kcfa. It's more recent. Otherwise, some of the others have the chances of fetal abnormalities happening would be equivalent to if somebody was not on any medication. There are some which you cannot definitely use. But as far as bipolar diagnosis, yes, there are some safe medications, and that one called Kcfa is safe. Can such a person on such medication do fasting? That will also depend on if you have other problems, like if you are diabetic or you have other existing problems. You have to gauge yourself. Just because you're taking medication for bipolar disorder, if everything else is stable and you're not like dry fast for a whole week. With moderation, I think there is no, it is possible. And it also depends on what medication you're taking, because something like lithium will need a lot of fluids, so it will also depend. So that one is like very individual. And I have another one here. I have a daughter, 36 years. She has had depression before. Recovered, used to drink and had stopped, but now drinks again. She has a job, but when not at work, she drinks heavily. She was a believer, but hardly comes to church or even brings her children to church. Could she be depressed again, and how can I help her? Do I pray? I do pray always. Now, depression is chronic, it's recurrent. And if somebody has had depression once, the chances of them having it again is increased just because you've had one episode. So having had one episode of depression increases your risk of having the next one, especially if the first one is not adequately treated. And as far as the treatment for the first episode of depression, if it is less than, most of the literature says 6 to 18 months, with effective treatment, both medication and therapy. And for me, I usually tell my patients that medication by itself is not enough, because medication will not help you with your thoughts and what you're thinking about whatever life circumstance you are in. And in this particular case, this is a 36-year-old female. She has been using alcohol. Now that's another, there's also genetic predisposition with alcohol use disorders and things like that. And if somebody is drinking heavily, that's added stress. She's drinking that to solve another problem, and she's increasing her chances of having other problems. So I think this particular person could have relapsed into another episode of depression. And, like one of the ones that we talked about, situational, but this one looks like it's more, genetic predisposition. And then, all these compounding factors, what's going on with the work? She's not going to work. She's not taking care of her religious, her spirituality, her family. Yeah, this person has relapsed, and she could have gone into another episode of depression. And how can I help her? Voluntary treatment. That if somebody is not suicidal, everything has to be voluntary. And relationships matter a lot. If they feel that they will not be judged, or they feel that they can, they have rapport with you, it's easier for them to open up and tell you, okay, or even be open to getting medication. But Like I said, medication by itself is not enough. You have to be in a good therapeutic alliance with a therapist or somebody else who's really helping you to address your thoughts. Because as the Bible says, as a man thinketh in his heart, so is he. And we also talked about this morning about ruminating. What are you constantly going on? What's constantly going on in your mind? Because with depression, most of the time somebody's saying, I'm not worth it, I don't look good, blah, blah, blah. And that's the regurgitation. Remember how she said it comes up? Those are the thoughts that are coming up in the person. It's all negative. And then the more negative thoughts beget more negative thoughts, and it begets more, so it becomes really a chronic. I can tell you one of the things I tell my patients, but maybe, let me just put it because I wanted to share this anyway. So I tell them, imagine your life is like imagine a big book. You know, like those big telephone books we have? Yeah. There are lots of pages on the right and lots of pages on the left. All the pages on the left have been written on. And some of the things that have been written there are actually very good. Some of the things are very bad. But this is a new page. And on this side, all these pages have not been written on. I have a choice what I'm going to write on this new page of my life. I can either cut and paste from what had been happening before and bring it to today. And therefore, I will experience today what I have continued to experience. I am in charge. When I decide today, I'm going to focus on how I'm going to write on this page of my life, using the thoughts that I think. I align my thoughts with what the Word of God says about me. So in this case, we're using both medication and therapy. Your thoughts. As a man thinketh in his heart, so is he. So I get to choose what I'm going to write on this page of my life. This is one day that has a definite beginning and it has a definite end. Everything that happens to me today, some of it I have control over, some of it I don't. But the ones that I have control over, I'm going to control it with how I respond to whatever's happening, and that's with my thoughts. And so I get a chance to choose. And also us, because we are Christians, we know that we are not doing this by ourselves. We have the person who is in us to help us to have the same mind of Christ. In fact, the Bible says that let this same mind that was in Christ in you. And so as you realize that this same mind was in Christ is in you, you can write with your thoughts anything that you want for you to experience whatever situation you're experiencing. Amen. So those are two.
Oh, this is really good. I'm glad we're doing this. I want to comment on a couple of things, just to add on to what has already been responded to. A couple of questions I got were about how to deal with rebellious young adults, especially when they're minors. It's a little different when they're 18 and over, but when they're underage and they're outraged and you're concerned, one of the questions was, what do I do? They will test your limits. Developmentally, they're at an age where they want to see what they can get away with and how far they can get away with something. So it's really important for us to, I like how Marcy put it, that those of us who were born in Kenya or came here probably after the age of 13 or 14, there is a way you were raised that you were to be seen and not heard, or you did have a say, you could ask, but why? You just did. And curfews were curfews, you never tested the limits. And we're in a society where you have to be careful about spanking, you have to be careful about your style of parenting or punishing your kids. They know how to call their authorities, and you definitely don't want your kids taken away from you. So you have to really get creative about how to, and again, I speak as a professional, not as a parent, in terms of how you relate with them so that you don't lose them, because the communication with them is really important, whether they are 12, whether they are 18, and they will test you. And the challenge on you is, can you love them beyond where they're testing you? Because the moment you lose them, you lose their trust. And it means they will do stuff and they will not tell you. Because they know immediately we will judge, especially as very sage tongue-talking people. This is true when I speak to Nigerian parents, when I speak to South African parents. All of them, in my workplace, the norm is, we have an African student who walked through the door. These are college students. They're like, okay, Dr. Dara. Because they said, what is mom and dad going to say? Pray about it. It's going to be okay. And we know that's not sufficient. So this is not a Kenyan problem. This is the islanders bring that a lot. Let's just pray about it. And it's as serious as when we need to put a kid in the hospital and the parents are like, I'm not coming. They need to pull up, study, get back in your room. We need straight A's. You're going to law school. Nobody cares what else you want to do. So there's a layered piece there, but when in this culture, we are taught to create space for them to express themselves, to pursue what they want to pursue, to challenge us conversationally. And so we have to flip a little bit and create space for them to challenge us in conversations without interpreting it as disrespect. Because the moment we interpret it as disrespect, we say, my mother never spoke to me like that. Now, we are not endorsing kids to be rude and disrespectful, but it's you being creative as a parent and knowing when do I hold my tongue and say, tell me more. You know, they say, but mommy, I need to go to this and the other. And say, let's talk about it. So you have to be creative about how you negotiate with them, who they're going with, where they're going, because otherwise you won't know what they're using. Because they know your mindset, and they get together and they say, my Kenyan parents think like this. And we are losing the communication line, so the more we create space, even when you don't like what they're saying, and saying, okay, let's talk about it, then they know mommy cares about me more than she's going to judge me. And watching who you're getting counsel from, because it's easy for us as saved people to collude and say, one of the questions said, people told me to just kick him out, kick my son out. And the moment you kick him out, you lose him. Because there's a world waiting out there to receive him and give him other things you're not willing to give. So I would rather, again, I speak as a professional, not as a parent. There are parents on this panel who can address this. But for example, your child is drinking or is using, you found, I had a parent call me 2 weeks ago and they said I found vodka in my over 19-year-old college student. Now don't flip. It's natural to flip, but try not to flip and say, okay, let's have a conversation. When did they start? Where is this going? I'm just trying to get you to have a conversation to gauge where it's a problem and then see who you consult with so that people don't go from 0 to 100 tongue talking, kick them out, because they will go and they won't come back. Or they will drink and you will never find out. Kids are so smart. They'll be using weed and you will never find out. I'd rather know and find a way to, okay, let's talk. Let's find a way. Well, what's going on here? That way you don't lose them, because when they are depressed especially, they don't have anybody who's affirming and loving. And if the home base, the love is lost, then the ground has opened. So they want to be able to know that no matter what, I can go home and before I'm judged, I'm loved. That right there is talking them off the ledge. That's what a lot of us do. If the only person who cares is the psychiatrist or the psychologist, we got a problem, because I become a lifeline when I spend an hour with them and you spend the rest before my next week appointment with them. So if you can love first before you judge first, then you know that at the very least they say, mommy, I've been thinking about cutting. Or I've been, even if it's just a communication, then you can run to us and say, what's my next step? We can give you hotline numbers, we can give you something like that. But a lot of the young adults I talk with, they say, I can't even bring this up with my parents. And it may come up as rebellion for you. It's like, you bought me a car, you gave me the keys, I don't have to come home. Or I'll come home at 2 a.m., I think that was a question, no questions asked. But if they know if they come in at 2 and you can still have the communication lines open, you may be able to pick up on some of the suicidal symptoms when they start coming through. They may feel okay if you went to their room and hang out with them, because there is a communication line, because they're not always signs, but most of the time they drop some signs along the way. But if you've lost that love connection, then you won't even pick up on any. So I guess the challenge I'm throwing to answer a couple of the questions that came was keep the love communications open. One-on-one time is so important. Go to a mani-pedi with your daughter, and you never know what they drop that could give you a sign about where are they. I like your garbage bag illustration, because it's a point of connection. Because generationally and in terms of our cultural adjustment, we are different. Because they are on this end where we are raising them here, we are on this end, we have this Kenyan history of my dad used to tell me I used to walk 6 miles to school. I'm like, great dude, I'm not gonna walk 6 miles to school. So let's talk about, should I get a car or not, stuff like that. So because we push them away because of our generational differences, whereas we need to bridge it a little bit so that we even get the negative information. It will help us in a little bit of the how part. Otherwise, we're really, really lost.
Thank you. I have grouped 4 of them, and in 3 of them, you have already touched on teenage. They are all within teenage, and the theme is similar. So to save time, I've grouped them. I will read them, and then I will just give a summary response, because Dr. Lillian has alluded to them. And then there is one that is not among teenage. I will read it, and somebody will say something. So the one about a teenage says, how do you deal with a person who is, this is not a teenager, but it's typical of a teenager, so that's why I grouped it. How do you deal with a person who is withdrawn and avoids you? It can be anyone, but teenagers are prone to doing that. I'm a mother of a teenager daughter. Me and my husband, we don't get along. Now my daughter does not do, because she does anything, but I think it means she does not do anything. Or does anything she wants. Not listening, to anyone. As a mother, I'm at a dilemma of what to do or how to go about it. She will go out and come back at 2 a.m. When I ask for days, please help, because that is a tough one. How do one deal with a teenager that call you names? My own child called me stupid after getting worried over his safety staying out till 12 midnight. I called a counselor, friends, but got so discouraged that I wrote an answer to kick him out. It was difficult for me, but I did kick him out. But I'm no longer comfortable talking about or sharing anything with him. And so finally, a teenager diagnosed with chronic sickness, you recommend mental therapy. Is chronic sickness medical or mental? So I teach family therapy. This semester I'm teaching family therapy over. The approach is that family is a system. When one member of the system is not functioning well or is unwell, the whole system is not functioning well. There is no one person who is sick in the family. One person is sick, however small, however big, the whole family is sick. The whole family is not functioning, is feeling the effect. Effective therapy is family therapy. Communicate to your teenager, don't communicate that you're sick, you're going to see the psychiatrist or the therapist or the doctor. We as a family, we are sick, we want to function well, we want to understand what's happening. We want to understand how to communicate. We want you to tell us what it is we are not hearing that's causing you to call names or to lock yourself in the room, or why are you withdrawing? What is it that you're not getting from this family that's causing you, you're deciding this family is not working for you, so you're withdrawing and maybe seeking support or help outside. So in addition to what my colleagues have said, family therapy, treat your loved one, your child, however small, as soon as they're old enough to say, I don't want porridge, they're old enough to sit in the family table business and be part of the conversation when they can make that decision. Go for therapy, whether it's counseling or therapy as a family. Find family therapists and sit as a family, let voices be heard, let children speak out and start to feel responsible. What I do affects this family. Things I say or how I say them, how I behave affects this family. When a child, a teenage child who came home drunk, they tried something the first time. It reacted badly and they were vomiting. They were so ashamed to tell their mother. A friend called the mother and said, I think so-and-so is not well. When she walked into the room, the child was so sick but said, just pray for me, just pray for me, I'm so sorry, pray for me. Sometimes they get in situations because of peer pressure. Sometimes they get in situations because it just catches them unaware. They were walking as a group and everybody's doing something. Don't send them to Canada because Canada now legalized marijuana at age 18. But people will sell them children sooner. They get into situations not meaningful. Yes, their time is different from ours and it's a blessing, not a curse. Ours was different from our fathers and the same. Our grandparents must have told our fathers how their times were much better than theirs. It's all going to be different. Our children, their children will be different. So no comparing. It is the nature of life. The next generation gets their own set of challenges, their own needs. We can't compare. We cannot expect them to be or behave the way we did. We had a different environment. But tell them, they are a member of this family. We are a family of 4. If one person is yelling or coming back late, you want to sit down. What is it? You are in school tomorrow morning at 8. Come home at 12, midnight, and expect to get enough rest to be able to wake up and go to school. We care about you. We know you have to have a body like ours that gets tired. Make it a family conversation. If you go to therapy, make it a family therapy. The family is only as strong as its weakest member. The family is sick when only one member is sick. So let them know we are one. We are all one. And you are experiencing these symptoms. Tell us what we need to know or do, and let's get support. The teenager or the child starts to feel responsible, part of the family, and part of the solution to the problem. This is our problem. How can we resolve it? How would you like to be treated or understood or communicated? So I'll read the last one, and I will ask for just a comment from maybe 1 or 2 people that was not teenage related, and I'll ask you.
The question is mental health pathological, spiritual, or demonic? And if it's spiritual or demonic, should it be medically treated?
Okay. I can say that I personally have seen. I saw somebody who I knew this was definitely demonic. Even the way the person presented and the way, just getting the history and everything. And that person, I actually advised them because I couldn't do it in the office. So I told them, you need to go to our pastor. I gave them the pastor's number. But for most of the people who I have seen, there is both a component of the biological aspect of the chemical imbalances and just abnormalities in the way the neural connections are happening for you, and the genetic predisposition, the early childhood experiences, the resilience, the structure of the family, all of this contributing, how the neurons are, as somebody is growing, some of them are pruned and some proliferate, depending on what kind of situations you are in. How all that happens in each person is very individual. So there's a lot of biology and physiology going on. And that's where I personally believe that there is the biological aspect. And the spiritual aspect, I think, comes, as we were talking earlier about that, we are not fighting against flesh and blood, but against powers and principalities. And that's where, how I incorporate that with my day-to-day work is what are you thinking about? What kind of thoughts are you meditating on? And as you meditate on thoughts that are helpful for you, and how I help people to stay in the present is 2 things. what are you grateful for right here, right now? What are you proud that you have achieved right here, right now? So you bring the person to the present and keep focusing on what is working, because all of us have some stuff that's not working. And if we focus on that, then we'll all be broken. But so we need to focus on what is working right here, right now. So the medication, I personally believe that it's necessary, but then, you know, what you're constantly thinking about. And then as far as the demonic part, you know, there is a role for that. But we can't say that depression is demonic. I don't agree. I don't agree. I wanted to say something about when you said about spanking. The police have come to our house twice. My daughter, I think, usually my husband is the one who's usually doing the japa. So twice the police came. She called 911, and when they came, everybody, there was no blood, there was no scars. So they, we told them the situation, and they said, yeah, you do have a right as a parent to discipline your child. Within, so long as you don't, you're not breaking bones. Yeah, your intention is not to abuse the child. I don't tell my patients that because you yourself, when you're disciplining the child, you have to be in a place where you're not angry yourself. Because if you're angry through the roof, you might hurt the child.
Make a point we have we can continue back to be aware that.
Yeah, so usually if there's any disciplining going on, the phone is right there if you need to call the police.
Yes. Has a question. Let me ask another question. I think it's a little bit long. That's why I didn't write it down. I hope everyone can hear my voice because I want to ask on behalf of very many people who are here quiet and not very innocent. But let's crack this nut, my sisters, and please allow me. Because life begets life. I want to imagine that all those questions we have asked, and it seems like the problem is with our children, would it be that there is a situation going on with us as mothers, not as parents? I said as mothers. Why? Because the reality is right now, quite a number of mothers in this immigrant, strange, different community, truth is that most of our husbands are either dormant or they walked out. Because the way they face the challenge of the different community, because our husband's morale. With all due respect, it does. And we want to be those African mothers and wives that we have always been. But when we come over here, because of the challenges that our husbands met, for some reason, it killed their morale more quicker than it killed our morale. But because, like Dr. Sarah said, we have to be resilient, now, most of us mothers, and I'm saying the voice of genuinely, you find yourself, you are dealing with 3 children, or 2, and you're the only one working because either the husband is not working, he's home, he's not working. We are in this community where you must pay the bill, where you must put food on the table, where you must sober up for the children so they don't go away, where you must lead and direct them, where you must deal with bullying from school, where you must deal with the haters, where you must deal with their different age group and therefore their different DNA system kind of thing. So it is like you find yourself also sick and stressed. And you are so stressed that, okay. Can somebody hear me first? Because our children are telling us, maybe, in other words, Mom, you're sick. And why are you telling me not to work 2 jobs? 1 job won't be enough to meet the need that is present. If I say I go to school so that I can do less and earn more, my children are also growing up. Unfortunately, life does not allow us to leave one and do one and come. Life demands that we multitask. Go to school, bring up children, deal with the different community at the level of your children, at the level of the husband, at the level of the woman, and you find that you are burnt out. Now, help us. Psycho-physio mental therapists and a spiritual therapist. How do we balance as mothers? Where do we run for help? How do we redefine and find ourselves so that when my child comes to me and locks herself in the bedroom and calls me stupid and doesn't eat the food I cook, and I'm saying, you know what? My mother did not bring me up. What we are saying is, I want to balance, but I'm also a baby looking for my mother. It's not that we want to bring Africa here. It's that we are saying, you know what? I wouldn't tell mom that, even when mom had 13 children. How do we redefine ourselves as mothers so that we heal well enough to, not to resuscitate, but to possess, to sabotage our children? Does that sound like somebody here?
That's actually that's very good. In fact, the question here was, how do I help an African man, that's my husband, who rarely communicates, has no male friends, is clearly depressed and would seek help. His depression is rooted on his wife. And yes, you are right. The way that women deal with stress is very, very different than the way that men deal with stress. And also, depending on how also you were brought up and how your genetic makeup and what all else you're dealing with. But definitely the men, our husbands, when they come here, they are, it's a very, very big shock. And you find that the wife is the one who is the breadwinner, working for the whole everybody, like she said she was working one day for every person. And then, the husband, and what happens is the more you work, the less the other one works. Because after all, you're handling it. So it actually can go against you when you are very strong. But at the same time, you can't just say because you're weak, also me, I'm weak. Each person is going to stand before God and answer for how you handled this one day, which I was given. I was given this one day, you were also given this one day. And how you dealt with it is between you and God. And how I deal with this is between me and God. So when my daughter comes and says she's not eating my food, I don't take it personally. It has happened to me.